what is rheumatoid arthritis? It is basically a long-term autoimmune inflammatory disorder in which body attacks its own healthy joints. Means the joint is there is no exogenous antigen, nothing else. What body is doing? It's an autoimmune process in which the body will attack its own healthy joint as well as the tissue near joints. In RA, usually the pattern is symmetrical and this disease can be seen more commonly in female, like the female to male ratio is 3:1 and the onset age is 25 to 50 years. Although I have seen kids suffering with rheumatoid arthritis as well. ठीक है, तो ऐसा नहीं है कि like the normal age is 25 to 50. ऐसा नहीं है कि only this age group can be involved. No, I have seen kids of 7-8 years having this disease. So ऐसा नहीं है कि you will only see this disease in this age group. Okay. So basically the etiology is unknown like other autoimmune disorders, but may involve genetic involvement like HLA, STAT4, TAF1 and C5. Like the predisposition is more in this type of genetic morphism. Then certain hormonal factors are there. Then we have environmental factors are there. Like for example, bacteria or virus aaya, unhone attack kiya and they have gone. But now what body is doing? The body is producing. The body has started attacking the own joint. Bacteria to chale gaya, but the immune response is there. Sometimes they can be the triggering factor as well. Symptoms kya hai? Whenever there is an inflammation, definitely all the inflammatory markers are there. ठीक है, यही होगा ना, एक autoimmune process है. This is a normal joint. Lots of जो भी chemicals है, सारे markers हैं आपके inflammatory, they will attack it. So what will be the presentation? There will be pain, tenderness, swelling. जो inflammatory we have rubber, pallid और सब चीजें जो होती हैं. So they will be the symptoms as well. Then because joint movement will be disordered, so it leads to joint stiffness as well. अच्छा, tenderness होती है ऐसी बात है. Okay, usually in RA there will be more morning stiffness. More than one joint is affected means the pattern is polyarthritis. Monoarthritis can be seen, but it's quite clear. Commonly, the pattern is polyarthritis, along with pain, fatigue, loss of appetite, and a low-grade fever. As I told you, like there is all the inflammatory markers are very, very active, so they will lead to fever as well. Loss of joint function. ठीक है? Okay. Diagnosis कैसे करते हैं? Basically, symptoms में करते हैं. That we can go for imaging, blood test, family history. Okay. So this is the criteria of for diagnosis of RA. ठीक है. अच्छा, इसमें क्या है कि the morning stiffness should be more than 1 hour. Synovitis in 3 joints simultaneously. Synovitis in wrist or hand, FCP or PIP joints. And the pattern is usually symmetrical. Symmetrical arthritis. Some joint areas on both sides of the body. Rheumatoid nodules in the later early cases of the fatigue, but नहीं मिलता. Serum rheumatic factor is there. ठीक है. अच्छा, as I told you earlier, or to those likely people are quite aware as well, that RA is not just related to the joints only. It's a systemic disorder as well. Serum RA factors can be seen. कभी ठीक है. अच्छा, radiographic changes typical of RA. So अगर क्या होगा कि इनमें से कोई भी 4 चीजें होंगी, then you can easily label the patient as a patient of rheumatoid arthritis. ठीक है. Complications क्या हो सकती है? It can lead to anemia, pericarditis, vasculitis, and it can also form subcutaneous nodules. In pulmonary, it can lead to pruritus and pulmonary nodules. It can lead to vasculitis and peripheral neuropathy. Similarly, it can also affect in conjunctiva. क्योंकि देखो autoimmune process is active. ठीक है. That autoimmune system can attack any part of the body. सही है. ठीक है. तो अच्छा. Okay. अब क्या करना है? Now we have to talk about the management. Management में क्या है? The goals of therapy are, first of all, देखो autoimmune diseases cannot be cured. अभी तुम लोगों को सब पता होगा. We can just slow its progression. We can just maximize quality of life. ठीक है? We can कोशिश करेंगे कि it won't exacerbate further. ठीक है? जहाँ पर है वहीं पर हो जाए. Your progression should be comparatively slower. ठीक है? ये हमारी goals of therapy होते हैं for any autoimmune disorder, not only RA but every disorder. So we can, what you have to do, ऐसे treatment दोगे that will elevate the pain, that will slow the progression or the rate of damage, and the preservation of function should be there, like joint movement होती रहे. ठीक है? And so these are the goals of therapy. So what pharmacological agents we have? We have NSAIDs. Whenever we think about NSAIDs, whenever we think about elevating pain, the first thing that clicks in our mind is NSAID. Then we have DMARDs. DMARDs too, because autoimmune process is there. Whenever autoimmune process is there, we have to suppress the immunity. The first thing that comes in our mind is DMARDs, then biological therapies and corticosteroids. So these treatment strategies are, it is not restricted to RA only. These agents can be given in SLE as well. ठीक है? तो भी सारी चीजें we are sharing. These are the common things. Okay, I don't want to teach you NSAIDs. Okay, I'm reading your chat, or you can unmute yourself as well. अच्छा, what is the mechanism of action of NSAIDs? मैं पढ़ाऊंगी नहीं, NSAIDs दिए जाते हैं, but I don't want to teach you. मैं तुम लोगों की chat देख रही हूँ, and I just want to see people are awake or sleeping. Okay, it inhibits COX enzyme. ठीक है? Which COX? COX1 and COX2. Which COX? COX1 or COX2? ठीक है? And ठीक है, I am COX2 only. Both COX enzyme. COX1 को भी inhibit करेगा and COX2. What is the normal function of COX1? And what is the normal function of COX2? COX1 का normal function क्या है? अच्छा, क्या इसको इस तरह करना है? Which one is housekeeping enzymes? Anyone? COX1. COX1 is basically related to the normal physiological things that are going on, like it secure the GI mucosa, prostaglandins की synthesis कराता है. What about COX2? COX2 is related with the inflammatory processes. Okay, I'm reading the chat as well. इसलिए हो रहा है. ठीक है? तो COX2 is related to the inflammatory process, and COX1 is basically like it is responsible for all the physiological processes that are going on. Okay, ठीक है? अच्छा, अब क्या करना है बेटा? Which enzymes like COX2 है? So do you know any drug that can only inhibit COX2 enzyme? Any drug that can, any NSAID that can only inhibit COX enzyme? Celecox है. ठीक है? क्योंकि इतना पढ़ चुके हो तो it's useless to teach you again and again. ठीक है? तो Celecox is something that is related to the COX2 enzyme, but definitely अच्छा, अगर किसी को, अच्छा, what are the potential adverse effects of NSAID जिसकी वजह से we have to think about prescribing COX2? किन पेशेंट्स से हम अवॉइड कर लेंगे? हम COX1 नहीं, ऐसा नहीं दे सकते. GI disturbances. For example, if a patient is suffering with ulcer, gastritis हो रहा है, then you have to switch to celecoxib. अच्छा, unfortunately, we have very limited options in COX2 inhibitors. इसकी वजह से क्या होता है कि we usually consider all those drugs that inhibit both COX1 and COX2. अच्छा, मैं क्या पूछना चाहती हूँ? What are the potential side effects of NSAIDs? I'm asking, मैं नहीं पढ़ा रही. I don't hypertension, renal damage, ठीक है renal damage में क्योंकि definitely ये सारी जो होती हैं they are nephrotoxic, so it should be ideally avoided. अच्छा ये मुझे बताओ बेटा, what are the potential adverse effects of aspirin के बताओ. When you think about aspirin, what is the first thing that comes in your mind as an adverse effect? Something related to the children, something related to its structure, its salt, the presence of salicylic bleeding होती है, Reeve syndrome. Children's में क्या होता है? Always think about Reeve syndrome. If you will give aspirin in viral diseases, it can lead to Reeve syndrome. Like COVID is there. COVID is a virus disease. ठीक है, headache हो रहा है, आपने aspirin दे दी, so it can lead to Reeve syndrome. ठीक है. अच्छा, secondly क्या है? अच्छा, what are the other adverse effects associated with aspirin? Hypersensitivity is there because salicylic acid. It's a salicylic acid derivative. So hypersensitivity is there. What about other things? Okay, so we have GIT disturbances. It can lead to stomach ulcer or anything. Headaches and dizziness, tinnitus, allergic reactions such as rashes. Tinnitus was like because of the salicylic acid, it can lead to tinnitus, wheezing and throat swelling, liver or kidney problems. Acha, I think I want to ask another question regarding you said something. चलो अभी एकदम से मिस हो गया, मुझे याद आएगा तो I will ask. अच्छा, so these are all about the MSETs. ठीक है, इसको एक दफा देख लेना क्योंकि ECQs आते हैं तो फिर. Now we are talking about GMARs. ठीक है, GMARs आ गए. They are known as disease-modifying anti-rheumatic drugs. What they will do, they will basically slow down disease progression. They may induce remission. They will prevent further destruction of joints and involved tissue and improve functioning. And it should be started within 3 months to get best result. Means if a patient is a diagnosed patient of RA, so it's not a good idea to wait for years to start DMARS. But definitely the therapy has its own adverse effects. Okay. We have methotrexate, we have sulfasalazine, we have minocycline, we have hydroxychloroquine, and we have lefuronamide. Okay. What is methotrexate? It is a folic acid antagonist and inhibits cytokine production and purine nucleotide biosynthesis. अच्छा, अभी क्या हुआ कि we all know about the pathology that RA is an autoimmune disease in which all the inflammatory factors are hyperactive. ठीक है, and they are actually destroying the own body's tissue and the own joints. ठीक है, अब क्या होगा? We have to suppress the immune response. यही होगा ना? ठीक है, तो हमने एक ड्रग है methotrexate, commonly सुनी होगी तो लोगों ने, कैंसर थेरेपी में भी देते हैं. क्या? It's basically a folic acid antagonist. And what does it do? It basically inhibits cytokine production and purine nucleotide biosynthesis. Hope this thing is clear to everyone. ठीक है? अब क्या होगा कि definitely what does it do? It is doing? It is basically suppressing the immune response. ठीक है? By inhibiting cytokine production. अच्छा, something I told you earlier as well. If a drug is inhibiting folic acid, what are the potential adverse effects? ठीक है, अब मुझे I want to see the answers in the chat देखते हैं. ठीक है, meanwhile let's pharmacokinetics देखते हैं. It can be given by mouth or by injections. ठीक है, elimination is kidneys. ठीक है, अच्छा, routine monitoring of CBC, liver function and creatinine are recommended. Okay, renal excretion, you have to see the creatinine levels as well. You have to see the LFTs as well, and you have to see the CBC. Why CBC is very important? Let's see क्या chart आ रही है. I am reading the chats again. If a drug is affecting the folic acid metabolism, ठीक है, what can be the potential side effects? This is my question. ये चीजें कुछ पढ़ चुके होंगे ना तुम लोग, थोड़ा आइडिया तो हो. Any idea? Bone marrow suppression. something, it is basically a common sense. Megaloblastic, any type of, it can lead to pancytopenia, it can affect the bone marrow. So when bone marrow is affected, it can lead to any types of cells. It can affect RBC, it can affect WBC, it can also affect platelets. Okay? So bone marrow suppression, whenever a drug is affecting folic acid, always think about these types of potential adverse effects. Okay? Okay. At least you people are not sleeping, and this is something very good. Okay. So effects kya hai? Immunosuppressive and anti-inflammatory effects, which is a carotenoid drug, should be highly avoided in this country. Adverse effects kya hai? Mucosal ulceration करेगा, nausea करेगा, cytopenia. कुछ भी भूल जाओ ना तुम लोग. Whenever you are thinking about कुछ भी DMARD आ रहा है, कोई भी immunosuppressive therapy आ रही है, something is affecting folic acid metabolism, जो purine pyrimidine synthesis से करेगी. Always the potential adverse effect होगा, bone marrow suppression होगी, it will lead to cytopenia. This is something जिसे तुम लोगों को एकदम से आता है ना कि nausea, vomit and diarrhea. So if something is affecting folic acid metabolism, always think about cytopenia, because cytopenias are usually related with these things. Secondly, these drugs have a potential to cause liver toxicity, hepatotoxicity होती है. Because that's why हम जब भी patient को देते हैं, we have to monitor CBC, LFT and creatinine. Sulfasalazine है. Sulfasalazine is again belongs to the sulfur group, and I think you should know this thing till now. The sulfur, if a compound has sulfur, so it can lead to hypersensitivity reaction. So basically, what does it do? अच्छा, अगर if a patient, हम ये कैसे पता करेंगे कि like sulfasalazine है and you want to prescribe this drug to the patient, आप कैसे पता करोगे कि the patient is not hypersensitive? Like आपने दे दिया और patient को एकदम से स्टीवन जॉनसन सिंड्रोम हो गया, तो कैसे पहले से कैसे करोगे? कोई भी इस तरह की ड्रग देते हैं अगर हम, आई एम वेटिंग फॉर द आंसर्स इन द चैट. कोई भी ऐसी ड्रग देते हैं तो हम कैसे पता करते हैं कि वेदर, ये कैसे अवॉइड करते हैं हाइपरसेंसिटिविटी रिएक्शन? कोई भी ड्रग हो, वेदर इट्स पेनिसिलिन, कोई भी ड्रग दैट हैज अ पोटेंशियल टू कॉज हाइपरसेंसिटिविटी रिएक्शन, हाउ कैन वी अवॉइड इट? हाउ कैन वी अवॉइड अ ह्यूज पिक्चर? Let's see. Test dose. Test dose is very important and it's a safe thing to do. Okay, even augmentine. Augmentine is something that is prescribed commonly in the hospitals. ठीक है, augmentine, even patient कोई भी आया surgery के लिए आपने पहले उसको augmentine लगा दी, ठीक है, pre-operative. So augmentine is something very common. लेकिन क्या है, तो कोई भी drug है ना, और especially if you are thinking to give it IV, always go for a test. The test dose they doge and a very minute quantity, you will get an idea that whether this patient is allergic to it or not. Okay, adverse effect aa rahe hain, loss of appetite, nausea, headache, rash, bone marrow suppression, liver problems and kidney problems. Then we have minocycline. Minocycline kya hai? Any idea what is minocycline? Minocycline kya hoti hai beta? ठीक है, DMARD में आती है. What is the other use of minocycline? I'm waiting for the answers in the chat. What is minocycline? Any idea? क्या होती है? So it's a very important drug in DMARD. ठीक है, क्या करती है minocycline? अच्छा, ये क्या है? It's an anti-inflammatory antibiotic of class tetracycline. So basically it's an antibiotic originally and belongs to the class of tetracycline. ठीक है, tetracycline is something teratogenic. ठीक है, याद है तुम लोगों को? ओके, ठीक है. Minocycline may improve signs and symptoms of RA. Then we have side effects में क्या है? If something is given orally, it leads to mild nausea, mild diarrhea, it can upset stomach, it can lead to rash, dizziness and feeling tired. Then we have hydrochloroquine. Hydrochloroquine कहाँ यूज होती है? Let's check. The chat antibiotic होती है. जी बेटा, जी सैयदा, अरीबा, तबस्सुम and मुस्कान. Yes, this is minocycline as an antibiotic. What about hydrochloroquine? What is the other use of hydrochloroquine? Malaria, exactly. So it's hydrochloroquine is basically an कौन सी drug होती है ये? It is not very clear that why hydrochloroquine is effective at treating autoimmune diseases. It is believed that hydrochloroquine interferes with the communication of cells in the immune system. अच्छा, ये मुझे बताओ, these days hydrochloroquine was something very important. Like बहुत सुन रहे होते थे, हम क्यों सुन रहे थे hydrochloroquine का? Something in our surrounding बहुत ज़्यादा frequently सुनते थे कि hydrochloroquine ले लो, and it's very essential. क्यों ले रहे थे हम लोग? कोविड में यही था ना, कोविड में थोड़ा सा सबसे पहले कि हाइड्रोक्लोरोक्विन ले लो. स्टिल कुछ लाइक कराची में तो मैंने नहीं देखा, but I have seen in UAE as well, people are still giving chloroquine, and in some hospitals in Punjab में मुझे पता चला that they are still giving chloroquine in COVID, because COVID is also there is the cytokine storm होता है ना, like ठीक है virus is there, but the reaction to the virus is also exaggerated. क्या होता है, पेशेंट के पास एक तो वायरस होता है कोविड में, then there is a very hyperactive cytokine storm. तो ठीक है, वायरस तो अपना टाइम 11 days खत्म करेगा, but to suppress that cytokine storm, hydrochloroquine is also given. क्यों कर रही है? Because it is believed that it interferes with the communication of cells in the immune system. ठीक है, effect क्या कर रही है? It decreases the pain and swelling of arthritis, it may prevent joint damage, it reduces the risk of long-term disability. अच्छा, जितनी भी ये ड्रग्स होती हैं, it will take time to affect. ठीक है, तो onset of effects takes 6 weeks to 6 months. इसलिए जो RA के पेशेंट होते हैं, they are not very happy with the treatment and they will take time. So hydrochloroquine के generalized adverse effects है headache, loss of appetite, nausea, vomiting, diarrhea, stomach pain. So you don't have to remember something special. Then we have leflunomide. Leflunomide is an immunomodulatory drug that achieves its effects by inhibiting mitochondrial enzyme dihydrofolate dehydrogenase, which requires for pyrimidine synthesis. अब बेटा आ गई pyrimidine synthesis, यानी building block of DNA. So what is the potential adverse effect? चलो, let's check the chapter. ठीक है, so I'm talking about leflunomide. It is basically an inhibitor of dihydroorotate dehydrogenase, which is required for pyrimidine synthesis, that is the building blocks of DNA. So what can be the potential adverse effect? क्या होंगे? Any idea? Rash तो चलो ठीक है, rashes वगैरह तो होंगे. Something is suppressing the pyrimidine synthesis, so the adverse effects are also similar to the इस जरूर bone marrow suppression करेगा. वैसे तो they are जरूर करेगा, and तो जब whenever there is a bone marrow suppression, it can leads to cytopenia. ठीक है, जब भी देखो CBC is very important. Why signs of infections are very important? Because when immunity is low, it can lead to infections. ठीक है, liver enzymes को derange करेगा. जितनी भी ये drugs हैं, they are basically hepatotoxic. ऐसी लिख देना कुछ ना कुछ अगर भूल जाओ तुम लोग. ठीक है, okay, diarrhea, weight loss, alopecia, hypokalemia, allergic reactions like that. Okay, now we have common DMARD combinations. They are methotrexate, sulfasalazine, and hydrochloroquine. Either we go for triple therapy, either we go for double therapy. That is methotrexate and leflunomide, methotrexate and sulfasalazine. So methotrexate is everywhere. ठीक है, methotrexate हर जगह लगा देना, उसके साथ ऐड कर देना. That's it. Okay. अच्छा, biological work. So अब we are talking about biological therapies. उनका benefit ये है, they work on specific targets instead of whole immune system. ठीक है, like अभी हम जितने दे रहे हैं ना, वो सारे inflammatory markers पर affect कर रहे हैं. अब क्या है कि they will target, they are comparatively they affect the specific targets. ठीक है, biological response modifiers are the newest and the improved class of drugs used to treat RA. बहुत boring लग रहा है ना biological therapies. Now I will tell you why it is not very boring, and it is something very important. They are genetically engineered to act like natural proteins in your immune system. ठीक है, slow its progression of structural damage, decrease signs and symptoms and improve function. अब हम देखते हैं. Okay, so why I was telling you that these drugs are very important because this tocilizumab is something, again, is a drug of choice in which disease? Tocilizumab. methotrexate क्यों दे रहे हैं? क्योंकि it is affecting the folic acid. तो जो cancers में it is suppressing the abnormal cells, ठीक है? इसमें भी it is suppressing. ये autoimmune है ना, abnormal response आ रहा है. It is basically suppressing. अच्छा, मैं तुम लोगों से पूछ रही थी कि tocilizumab is a drug of choice in which infection, जो तुम लोगों को अभी एकदम से biological agents में इंटरेस्ट हो जाएगा. I want the answer. किस डिजीज में हो रहा है टोसी का यूज बहुत ज्यादा? इट इज अवेलेबल विद द नेम ऑफ एक्रेमा दीस डेज. एक्रेमा के नाम से भी आती है. टोसी इज द नॉर्मल नेम, एक्रेमा इज द ब्रांड नेम. बेटा कोविड की ट्रीटमेंट है टोसी. दो ही तो ट्रीटमेंट यूज हो रही है. कोविड की वर्ल्ड वाइड ट्रीटमेंट चल रही है, ग्रामिडिस्मिक चल रही है, सेकंड टोसी चल रही है. टोसी, अच्छा एज आई टोल्ड यू, कोविड का लेक्चर तो नहीं है, लेकिन क्योंकि एक ही एजेंट है, तुम लोगों के इंटरेस्ट की भी बता रही हूँ कि कोविड में भी देयर इज एन हाइपर, एक साइटोकाइन स्टॉर्म होता है एंड वी हैव टू सप्रेस इट ताकि पेशेंट सर्वाइव करे. ठीक है, तो टोसी इज अ ड्रग ऑफ चॉइस एंड ड्रग्स, ठीक है. देन वी हैव अदर ड्रग्स एज वेल. अच्छा, इनमें से कुछ अदर ड्रग्स भी जो है एफडीए ने अप्रूव करी है. एक और थी समथिंग, इटानरसेप्ट तो नहीं थी, एक और ड्रग थी जो अमेरिका में यूज हो रही है, पाकिस्तान में भी यूज नहीं हुई. It is again belongs to the specific biological agents. ठीक है, तो toci is always there. Toci is a drug of choice worldwide, but we have other agents. अब हम यहाँ talking about RA, so we have other agents as well. We have etanercept, we have adalimumab, we have anakinra, we have abatacept, we have infliximab. All the mabs are there. ठीक है, याद कर लेना नाम. ठीक है, अच्छा, tocilizumab. The talk of the society these days is basically a monoclonal antibody. देखो अब ये पूरे immune system को affect नहीं कर रही, but it is affecting against the interleukin 6 receptor only. ठीक है, तो क्या करेगी? सिर्फ interleukin 6 receptor को act करेगी. The drug slow down the progression of the disease. It improves physical functions of patient, used for the treatment of moderate to severe RA, IV infusion. ठीक है, अच्छा, what are the adverse effects? अच्छा बेटा, इसमें वैसे तो कह रहे हैं कि ये सिर्फ इंटरल्यूकिन 6 रिसेप्टर्स को देती है, ठीक है, उसकी को एक्ट करती है, उसकी को सप्रेस करती है. लेकिन व्हाट आई हैव सीन इन द पेशेंट्स विद द कोविड, जितने भी तुम देखोगे या तुम लिटरेचर भी सर्च करो, कि व्हेनेवर द पेशेंट इज गिवन एक्रेमा और tocilizumab, क्या होता है? सडनली द इम्यूनिटी बिकम्स सप्रेसेस. इम्यूनिटी जब सप्रेसेस हो जाती है तो फिर क्या होती है कि इट लीड्स टू different types of infections, like upper respiratory tract infection. ये तो कुछ भी नहीं है, लेकिन कोविड में मैं देखते हो, तुम लोग भी पढ़ते होगे, being a medical student ज़्यादा एक नॉलेज होती है. तो क्या कर रहे होगे कि there are different, the patients are at the risk of different types of infections, like the fungal infections. कौन सा fungal infection हमने अभी लास्ट डेज पढ़ा था? ये black fungus क्यों होता है? tocilizumab की वजह से, and steroids की, because they are suppressing the immunity a lot. That's why जो ये ड्रग्स होती हैं डीमार्ट और जो बायोलॉजिकल एजेंट होते हैं, थोड़ा सोच समझ कर लेते हैं, because they have a potential to suppress the immunity. ठीक है, then we have certolizumab pegol. ठीक है, it is again a monoclonal antibody, but it is directed against only TNF, tumor necrosis factor. Tocilizumab was effective for IL-6 and it is effective for TNF. ठीक है, एडवर्स इफेक्ट देखो, एडवर्स इफेक्ट जो ज्यादातर आ रहे हैं ना, वो इन्फेक्शन से आ रहे हैं, लाइक स्टफी नोज, साइनस पेन. ठीक है, अपर रेस्पिरेटरी इन्फेक्शन. ठीक है, इट इज सप्रेसिंग द इम्यूनिटी. देन वी हैव इटानरसेप्ट. ये क्या कर रहा है? इट इज बेसिकली इंटरफेयरिंग TNF, साइड इफेक्ट्स आर सिमिलर. देन वी हैव adalimumab. इट इज अगेन अ मोनोक्लोनल बॉडी एंड दैट बाइंड्स टू TNF alpha. ठीक है, देन वी हैव second. Then we have infliximab. This is a monoclonal antibody, binds specifically to TNF alpha. अच्छा, जितने बायोलॉजिकल एजेंट्स हैं उसमें से टोसी को क्यों पिक किया गया? बिकॉज इट इज इफेक्टिव अगेंस्ट IL-6. Otherwise, the rest of the drugs then they are effective against TNF alpha, majority of the biological. ठीक है. Okay. अब आगे क्या आ रहा है? Okay, then we have steroids. Steroids are something very commonly given to suppress the immunity, to control inflammation and damage caused by RA. Can be used as a bridge therapy while waiting for DMARD to work. Like अच्छा कौन से steroid आते हैं like prednisone, prednisolone, both have anti-inflammatory effect. ठीक है. अच्छा mechanism of action क्या होता है? They bind to the receptor and transport the steroid into the nucleus where it attaches to the gene promoter. Something is going inside the nucleus, most probably it will affect the gene. इस physiology में भी तुम लोगों ने पढ़ा होगा. फिर genes का जो response आएगा, usually late